Hello and welcome to Talkin Telehealth. I'm Erika Grau.
And I'm Kathy Ford.
Telehealth is having a dramatic impact on the way patient care is being delivered. On our show, we'll examine how telehealth can simplify communication, improve office workflow, and most importantly, drive better patient care. In addition to hearing some great clinical stories about telehealth in practice, we'll talk about where telehealth is today and where it's going, including how the latest regulations are impacting provider operations and reimbursement. You can find podcasts of previous episodes of Talkin Telehealth on our program page at healthcarenowradio.com and rhinogram.com. Be sure to follow us on Twitter at #TalkinTelehealth and follow us at Rhinogram on Twitter. All right, welcome back, everyone. In this episode, we have an amazing guest with us today, Dr. Keith Dressler. Dr. Dressler has 35 years experience in private orthodontic practice and currently serves on the advisory board of the American Teledentistry Association. He is also an avid entrepreneur. In 2000, Dr. Dressler co-founded OrthoBank, a cloud-based automated accounts receivable platform that is currently serving over 4,000 healthcare providers, managing more than $650 million annually. In 1998, Dr. Dressler co-founded Elite Physician Services, a national healthcare patient finance company. As CEO and chairman, Dr. Dressler grew the business to $200 million in sales before it came to be known as the City Health Card in 2003. And today, Dr. Dressler is chairman and CEO of Rhinogram, a leader in cloud-based HIPAA-compliant telehealth communications. So I call you Dr. D. So welcome, Dr. D, and welcome to Talkin Telehealth.
Thank you, Erika. I am so thrilled to be here. Obviously thrilled to be with you. You're one of my favorite people.
Oh, well, good to be a favorite, that's for sure. So let's kind of kick things off. And why don't you tell us about how Rhinogram started?
Well, around 2013, I discovered I had a huge problem in my practice around healthcare delivery. And what I discovered is now understood as the age of consumerism in healthcare. Patients wanted convenient access to services, care, advice, administration, without having to drive somewhere and without having to make a phone call. What I learned was my staff who had cell phones, patients that were friends of theirs, were texting them, can you change my appointment? Do I need, they're at their family dental office and the patient had taken a picture of the x-ray there and said, hey, can I get my wisdom teeth out, or do I need my wisdom teeth out? And my staff were making clinical decisions without my knowledge at all. I had no idea that these communications were going on. Also at about that same time, Facebook had come into being, and I was into it, and we had a business page and that sort of thing, but they did not tell us. They added Messenger, and the second Messenger was added, I was getting all kinds of questions like, I've lost my retainer, how much is a new one? Hey, I'd like to be a new patient, how much does braces cost? Do you do Invisalign? Do you accept this insurance? All these things were coming in, and I wasn't, literally no one was monitoring the page, and we were not responding to literally months and months down the road from whence it came. And I realized nobody's monitoring it, so that there was a big problem. And that is, again, patients were communicating with my practice the way they preferred to communicate.
Right.
And yet there was nothing out there in the market today that basically handled all of that communications and handled it compliantly, because patients were looking for the convenience they've come to know and love, and yet it was being done in a non-compliant way. And from a legal standpoint, I was scared to death that some of these conversations that could have been going on could have put me legally at risk. I also want to share that I realized I'm one about, I separated myself in my market for years by believing in the exceptional patient experience. And I had to take a step back and look at it, because I definitely wasn't giving them the experience they wanted. and I began to look through my patient's eyes and try to figure out how can we deliver what they want and give them the convenience they want and the compliance that the practices need. Hence, Rhinogram was started.
That is great. I love that story and how kind of you searched, couldn't find it, so you built it.
That's right.
Such a great story. So let's talk specifically how consumerism has been disrupting the oral health market today.
Well, in today's world, you've got the do-it-yourself or patient aligners that are straightening teeth, and these big corporations, direct-to-consumer corporations, are spending literally hundreds of millions of dollars in advertising, pushing the consumers to do what they want, and they're actually giving the consumer what they want. Now, I don't necessarily agree with how treatment is and that the consumer should be the ones necessarily treating themselves, but at the end of the day, they are pushing the envelope. They are driving, at least in the straightening of teeth arena, they are pushing consumerism to the limit. And they are targeting millennials like you, Erika.
Yes.
And they're targeting people who may have had braces treatment in the past, who've had a few teeth that have moved and are basically making it seem like it's real easy and not dangerous to move them back. And what we would term maybe me being an orthodontist as a very simple case, but some simple cases aren't simple once you begin to take x-rays and look deeper into the case and the bite. Even if they have been treated, it still may not be simple to correct on your own.
So this is taking away simple, easy cases from orthodontists, isn't that correct?
It absolutely is. And anybody who does them. I mean, family dentists treat with clear aligner treatments that are out there, and it's not just orthodontists doing aligner treatments anymore. I mean, it's really the dental community doing it, but you definitely need the expertise behind the care, not just, oh, here's your box and with instructions, and somehow that's going to help you. And if you come into problems, you don't have anyone to call. So that's, again, some of my beef with it, because we're truly healthcare professionals where we spent years and years learning diagnosis and treatment plan, and not everything is easy as it might look, you know.
So going kind of back to millennials in healthcare is such a hot topic. Last year, I think it was one of our biggest topics that we talked about. And I am a millennial, as you mentioned earlier. I've grown up with a cell phone in my hand. I don't know a world without it. And it's interesting because all of those things that you were talking about, convenience, access, we are kind of now expecting that from our providers. So that's kind of why maybe people are turning to those direct-to-consumer aligner companies.
Yeah, I would say absolutely that's why. And you have to realize people 23 to 39 years old make up the largest consumer population today. It's 80 million of those folks.
Wow.
They are the consumers and the largest group of consumers, and that would be mainly millennials, some Gen X's, however you want to term everything. But these patients, they do expect and demand the same type of convenience that they've grown accustomed to and known really their entire lives. These type of patients don't pick up a phone to voice talk. They will pick up the smartphone to basically get online and get done what they want, when they want, and how they want. And voice communications is basically a thing of the past with this generation. This generation absolutely loves texting, social media messaging, and if you don't modernize your communications in your practice to being able to accept those forms of communication and what I would consider a new form of patient acquisition, then every year that goes by from this point forward, you're losing out on those folks. And you may say, well, I may not want to do it, or how many of these can they be? Well, all I have to share with you is that one of the most famous brands of direct-to-consumer aligning companies treated 600,000 cases last year, and out of maybe 4 million total orthodontic cases that are treated in the United States. So that's an extremely high number, and that's basically sharing with all of us that these folks are leaning that way because the direct-to-consumer aligner companies have made it simple and easy for them to be acquired. I would say, hey, your practice needs to modernize its communication. If you force people to get answers to their questions by having to have an in-person, face-to-face visit for their questions, for all of their questions, then you may lose out, because they're going to probably find someone that is going to answer them virtually, online, maybe even through video or whatnot. But I'm sure there are ways in which you can acquire patients online now that keep them from having to come face to face for their initial bunch of questions.
Mm-hmm. So you actually advertise that on your Facebook and on your website as well, that you're able to do those kind of virtual visits. Is that correct?
Yes, no, I do. I want to make it as simple and easy for any patient who's searching around, whether it's on my website. By the way, my website has a website widget that basically says message us now, and they can click on that and start texting directly with my practice right from my website. Obviously, my Facebook Messenger, they can go there. If I have an ad and it says message us, it comes right to my practice through Rhinogram, and it's HIPAA compliant and protected, et cetera. And my telephone number is textable. So in everything we do, we say text us, text or call us. You have to educate the market that it is patient-initiated conversations that are occurring. It's not doctor-initiated communications. What I'm talking about, there's a huge difference here. What is out there today and what I was doing in the past was sending appointment reminders, sending happy birthday emails, sending lots of things. Those are doctor-initiated. Patients have no clue they're going to get them. They don't know when they're going to get them or what they're going to get. What this does is really modernizes communication, because it gives them access to my practice when they want it and how they want it, which is very, very different than them being inundated with stuff from my practice versus them contacting me when they want to and on their terms. So that is huge. So I want to be able to acquire people. I want to be able to continue to communicate and converse with them the way that they prefer to converse. And Rhinogram obviously is the platform that allows me to do such.
Awesome. After the break, we're going to talk about how Dr. D has improved his practice after implementing a new telehealth platform. If you're just tuning in, you're listening to Talkin Telehealth with Kathy Ford and Erika Grau. This episode has been brought to you by Rhinogram, a leader in cloud-based HIPAA-compliant telehealth communications that connects patients, clinicians, and office administrators through confidential text-based interactions in real time. All right, welcome back. Okay, so as a practicing clinician, can you talk to the audience about what telehealth adoption has meant to your practice?
Yes, there's many, many things that has occurred through telehealth adoption. I'm going to start by what we sort of ended the last little segment before the break on, and that's new patient acquisition. And I have been able to incrementally increase my new patient acquisition through online acquisition 30% of new patients come into me now online, which is a far different thing than ever before, where most of my patients, if not all of my patients, came either from a patient referral or a family dentist referral in the past. Now, the vast majority are coming from patient referral and this new form, which is online acquisition. With online acquisition, the beautiful part of it is I've been able to answer all their questions online before they walk in my door. Most even pay for their visit, or in orthodontics, it's a contract, so it might be their down payment. We have been able to talk to them about treatment, what type of treatment, how much it's going to cost, what their insurance is going to pay, set up pay arrangements, and most will pay their down payment prior to ever walking in the door.
It's really impressive.
Yeah, it is awesome, which again, it does not preclude my initial exam, because examining x-ray, going through all of that is still a critical piece. What seeing pictures of their teeth do prior to them getting in, it gives me the ability to do a cursory exam. And really 95, 98% of these cases, I can do what I just described. 3 to 5% of these cases, or 2 to 5%, I can't tell from the pictures, or they have baby teeth and I don't know what's underneath them, if anything. And I basically explain it is too complex, or there's not enough data in the pictures for me to be able to even do a cursory exam. Would you be willing to come in for a free exam with x-rays? And of course, the vast majority, but not all of them, say absolutely. They want to come in. They have actually, through texting back and forth with them, in the way that they initiated it, you have developed an intimacy with them like no other. Meaning the bond that's already created, even though it's virtually, is like no other. They feel like they've got access to you better than any other provider that's out there. And subsequently, if all of their questions are answered, and in specifically it's affordable to them, they're going nowhere else. They're going to you. If it's not affordable to them, well, they're not going to anybody, and they're not going to you. But they will tell you that because the anonymity behind what I call the texting or messaging mask, people are way more truthful to you about everything, versus in the office, they will not tell you, they will not tell your financial coordinator or your treatment coordinator what the real deal is. They'll make excuses. You'll spend lots and lots of time trying to follow up with no real success. And the real reason maybe they had no idea it was this expensive, and they'll never be able to afford it. They will tell you that behind the texting mask, so you don't waste a lot of time with people who truly will never have it done.
Love that. I want you to kind of talk more about the photos that you get. So that's a question that we get a lot, especially people, when they think of telehealth, they think traditional telehealth, or kind of
video.
Exactly. They think video, and they think that video is the only way to assess a patient. But you always say that your patients, as most of them are millennials, grew up with a phone and they're professional at taking photos. So talk a little bit about that.
And again, there are certain things in medicine that pictures are not going to work with, but for those things that they do work with, and those particular healthcare verticals they do work with, then to me, pictures are much better than video, and really much more convenient, and makes workflows so much easier because you can get to them when you want to get to them. Patients aren't expecting you to be right back. If they send you a picture of their teeth, we send out write a text back to them saying, thank you for submitting your photos. Dr. Dressler will get back to you before the end of the day to set an expectation. And when I have free time, in my day, I get to the photos at my leisure and can get back to the patient about what I think is going on, how we can treat it, how long it would take, and the types of treatments that would be effective treating their particular case. But to your point, they take pictures unbelievable.
Yeah.
And I hope my staff doesn't listen to this, but they're as good or better than them, because you show them what you want, they give you virtually exactly what you want. To think they can't take quality pictures is really a misthought. And with the phone qualities of the cameras in the phones, they are potentially better than your medical grade cameras that you have in your office. So again, the ability to enlarge them, to enlarge the pictures and look at things is really, really, really good.
That's great. So as a practitioner, what kind of advice would you give to a colleague that might be looking to add a telehealth program or add a new patient communication platform to their business?
Well, the advice I'd give them is it's where everything's headed. I mean, to sort of put your head in the sand and think, oh, it's a fad or something like that, it's not really paying attention to the world. And like I said, every year that goes by, more and more people are going to want to communicate in the form that I just described. And you use the word telehealth. That responds, in my opinion, that is the care side of it. Also, I would like to share with any medical listeners that are out there that in about 39 states, they're coming up with reimbursement codes so that you can be reimbursed for the same for a virtual visit, a virtual follow-up, as if it were a face-to-face follow-up. It is regulated state by state, so you'd have to check, see what the state is. And they're coming up with a lot of payment parity laws that basically say just that. Whatever you charge for a face-to-face follow-up visit, you can charge for a virtual follow-up visit. I give this example quite frequently, but if somebody cut their hand and they went to the doctor and had stitches in it, and the doc says, hey, I need to see you 2 weeks later to make sure you're healing okay, that your wound is healing okay. Well, traditionally, you go in, the doctor, you sit in the waiting room however long, he called back, doctor would look at you for 2 seconds and say, hey, you're healing well, and the doctor bills for that visit, and you pay a copay, and you've had to waste a whole day of work, and they have bogged down their schedule for something that could have occurred in this manner. The patient could have been texted, it's 2 weeks out now, please text us a picture of your wound. You simply turn around, text them a picture of the wound. The text would also probably include, have you been running a fever or anything like that? Because it's important to know if they feel like you truly have an infection or not. And you would say, no, my temperature's been fine. And then they would be able to say, yes, look, the wound looks good. It appears you do not have an infection. We'll check back with you in another 2 weeks. And this could be all done through text and what we would call asynchronous telehealth. Telehealth's all part of the modernization of communication, because care is only one thing that is being communicated, but you can see that one thing by being able to provide this service can separate your practice from all others in a highly competitive universe today.
Kind of gets me into my next question. So, big picture, what do you think about the future of telehealth? Where are we headed?
Well, it's only going to increase, and the beautiful part that I think is government wants it to happen, insurance companies want it to happen, whether it's Medicare, Medicaid, or whether it's private insurances, they see the need. Also, it may be forced to happen. Why? In studies show in 2025-ish area, there's going to be a real shortage of doctors, physicians, clinicians in the United States. So in order to be able to treat all of the people, they have got to find a way to do it more efficiently, more effectively, and that sort of thing. So I just see it exploding down the road, 5, 10 years from now, and eventually it'll just be the way healthcare is delivered. It'll be a new delivery model that's more efficient and effective, where you'll see less acute things be treated virtually and more serious things in the face-to-face traditional manner. And it would really become a hybrid type of treatment transition, if you will. But it to me is the most logical, because everybody virtually has a cell phone. And so you're basically, telehealth delivers care to the phone in some sense. And you're connecting, the patient through the phone to the provider's practice and the necessary people needed to treat, follow up, engage. And it truly increases access like crazy, because patients feel they have direct access to that practice by communicating with them like they prefer and like they do everyone else in their lives.
Awesome. So, as many of you may know, Dr. D actually just spoke at the National MGMA show just a few months ago. That was such a great show.
Yes, it was.
And you have a very busy year
I do.
of speaking engagements. So he is going to be on the road talking about telehealth and what's going on. Up next, he'll be at the Iowa MGMA. So if we have any listeners that will be attending the regional Iowa MGMA show, be sure to find Dr. D there. He will be talking about telehealth there.
That is awesome.
Well, thank you so much for joining me. I hope you had fun with me today.
I had an incredible time as always, and I love being on your show. I mean, Talking Telehealth is a super fantastic idea, and I know you and Kathy Ford do an incredible job. So proud of both of you, and again, educating the healthcare world to what's out there and what's coming is quite impressive.
Thank you again for joining us. This has been Talkin' Telehealth. Next month, we have another special guest. We are going to be talking telehealth integration strategies with Shannon Hastings. Shannon will address the sometimes tricky challenge of telehealth integration while teaching you how to wake from your integration nightmares. Thank you for joining us today on Talkin' Telehealth, recorded at Rhinogram headquarters in beautiful Chattanooga, Tennessee. You can learn more about Talkin' Telehealth on the show's program page at healthcarenowradio.com or rhinogram.com. Find us on iTunes under Healthcare Now Radio, or tune in Monday through Friday and listen through your smart speaker by asking, "Play Healthcare Now Radio." Be sure to connect with Rhinogram on Twitter, Facebook, and LinkedIn. We'd love to hear from you. And remember, if it's in the world of telehealth, we're talking about it.